Many of you watching tonight have young children. Some of them are probably bouncing off the walls in between being urged to sit and eat their dinner or get in the bath. Most of this is normal behaviour. OK, it's a bit distracting, sure, but it's normal, right? Australian researchers say these behaviours are leading to an overdiagnosis of attention deficit hyperactivity disorder, or ADHD, a label that can do more harm than good. Luise Kazda from the University of Sydney School of Public Health was one of the researchers working on the study.
The problem is there is no definite biological threshold to these behaviours. So on the one hand, I think excessive and really problematic behaviours are relatively easy to identify. But as you move further towards the mild behavioural difficulties, it gets really blurry and sort of difficult to distinguish which child may be struggling and which child just may need a bit more attention and just maybe is a bit more immature than his peers or her peers. Also, what we found that even though diagnosis rates are really increasing, this is not reflected in any way in increasing symptoms in the population. So we didn't really find that children have been getting more hyperactive or more inattentive over the last 20, 30 years. One of our concerns is that really by widening this so much, ADHD is really reduced to this controversy rather than being recognized as a real challenge that some children and parents face. So the diagnosis itself gets watered down in a way, it loses some of its legitimacy, and maybe more in practical terms, it becomes obviously more and more difficult for them to access support that they need in education settings or in terms of specialist care, because the group of children just grows and grows.
Neela, is there a danger in overdiagnosing children?
Look, this paper has created ripples amongst the paediatric aspect of the medical community. I'm not a paediatrician, but I've certainly spoken to some paediatricians about this paper. I've spoken to some statisticians about this paper. You know, these sorts of diagnoses are complicated. They are nuanced. They're generally made by teams of people. They are generally made by people who have very specific expertise in diagnosing these conditions. So I think that the suggestion that there is an overdiagnosis, particularly in a context where a vast majority of children who need this sort of specialist care cannot access it because there is a shortage of publicly funded services that provide this sort of assessment, and it is catastrophically expensive through the private system for a lot of families, particularly lower income families, is troublesome. This paper looked at studies from around the world. It wasn't novel research. It was a review of research that has been done. There are different criteria that are used in different countries, and so perhaps it's not easy to extrapolate, for example, the American experience to the Australian experience. What was clear from the study is that diagnoses have gone up. That was certainly true. Whether that represents an increase in diagnosis of mild patients is equivocal, and whether there is any harm that is done because patients with milder forms of these issues receive a diagnosis is not really a conclusion that can be drawn. I saw that the author had written an additional piece in the conversation about this, where they made the issue. They raised the issue that if you diagnose too many people, then those with more severe disease may not get access to treatment. I think that that's a really problematic argument, because what it says is that what it's not calling for is an increase in the kitty. What we need is more services that can provide these services. What we need is more treatment options. What we need is better ability to analyze the treatment options that are available. And I think that's really hard in a lot of medical conditions. And I think it's probably particularly hard in a lot of pediatric conditions, because you may not see the effect of early intervention for these conditions for 5, 10, 15, 20, 30 years. And so for researchers, it is difficult to follow that up. And for governments, which are predominantly short-term governments, investing in interventions that may or may not yield benefits in decades' time is a hard ask. So I would hope that people would look at that particular study with a huge amount of caution.